thank you so much for coming in for what I think is going to be a really fun session, an exciting session, and a very educational session. This morning we have Laurie Proulx, has lived with juvenile rheumatoid arthritis for 25 years, and is her experience that has led to her involvement in the Canadian Arthritis Patient Alliance, a grassroots patient-driven and managed organization. Through her involvement with this organization, she advocates for patient-centered healthcare policies and practices for people living with arthritis. And she works extensively as a patient partner in health research and health organizations across Canada. So welcome, Laurie. And we also have Campbell, who has, at least to my knowledge, been very active in a lot of the medical school education, though probably Laurie has as well. Hélène is a patient leader behind what is now known as the Hélène effect, making things happen through the power of her magnetic personality, her unbridled enthusiasm, and her limitless optimism, her passion, and her iron will. Hélène is very grateful and feisty, two-time double lung transplant recipient, and calls herself the French-Canadian double-double. Hélène works alongside patient partners and staff at the Health Standard Organization and Accreditation of Canada to strengthen standards development, assessment services, and the practice of people-powered health by integrating and supporting patients in clearly defined and purposeful roles. She is passionate about her work and continues to try to engage patients in the design, delivery, and the evaluation of health services. So it's with great excitement that I'm going to let the two of these guys lead us through. But quickly before we do that, I'm just going to say there are going to be two ways that you guys can be involved in this conversation. One is through questions. If you want to put them in, I will be monitoring them. And those are just to the right hand of your visual space. And then at some point, you will be directed to put things also in the discussion forum. So I will let Hélène and Laurie describe to you when they want things in the discussion forum. Take it away, guys.
Thanks so much, Allison. And thanks for the introductions, or the kind introductions. I'm really happy to be here with Hélène Campbell. And as you'll notice, we're on social media, so we've put them on the main slides here. If you happen to be on Twitter, you are more than welcome to tweet about this if you wish. So, whoops, all right. Let me try this again. There we go. Here are our disclosure slides for everyone to take a look at. And so, yeah, we're really happy to be here today to define or to provide some perspectives as people living with different health conditions on patient involvement in their care. So we hope that you'll come out from this conversation knowing how to better involve patients in their care and to identify opportunities to do that in a practical way. So a little bit about us before we get too deep into it. So I'll start and I'll pass it over to Hélène. So, I mean, I've been living with juvenile idiopathic arthritis, or, you know, it was called something else back then, since I was 14. And really this chronic illness has followed me through much of my life, through high school, university, work, marriage, and kids. And I like to show a picture of my family just because, you know, I'm speaking to family physicians, so it just seems, you know, appropriate that you should know about my family. And my health really has an impact on my whole life, or my whole family, and extends sort of beyond them. So in my 30 years of, you know, quote unquote experience, you know, I have interacted with a lot of different physicians. I have a family joke, really, that, you know, is there a kind of doctor that I haven't seen at this point in my journey? So I've seen like so many different healthcare professionals, pharmacies, you know, specialty pharmacies, regular pharmacies, in and out of hospital. I've had 8 surgeries. And really, like, my family doctor has played a really critical role through that. They're really like I see them as like my last line of defense when I kind of get lost and I need some help to pull things together. And I really see their role as being super, you know, important. So by day, I actually, you know, this is not my full-time job. So I have actually worked in human resources. And I like to think that I take my night job, you know, as a patient advocate and my involvement with the Canadian Arthritis Patient Alliance, you know, because I like to do things with my clients, you know, as opposed to for them. You know, I like to really, you know, I think I sort of live and breathe sort of co-design and those sorts of things, even in my work. So I'm a vice president too with the Canadian Arthritis Patient Alliance, which has brought me into a whole new world, one I never would have guessed I would even enter, as a teenager, being, diagnosed with this very difficult illness. So I'll pass it on to, Helen so she can introduce herself.
Thank you so much, Lori. And it's such an honor for me to be able to present with such an incredible person. And I'm just really grateful to be here today. So thank you all for coming to this session. My name is Hélène, but I'm also known as ma tante Hélène. Recently, my sister had a baby, and it's the first in the family, and it's really, really exciting for me. I'm a dog mom. And as was mentioned earlier, I call myself a French-Canadian double because of the 2-time double lung transplant recipient. And I am an organ donation activist by day and a patient engagement partner by all the time, 24/7. I work with Health Standards Organization and Accreditation Canada to help build services. We partner with patients and families to be sure that what we're doing is aligned with what people really want. And so we're developing standards that are true, and we're not making faulty assumptions about things, but we bring in that lived experience because there's so much perspective, and there's such a rich perspective when you bring in patients and families. And when I say patients, I could mean clients or residents. It's not just patients themselves, but it kind of falls under the different category. But I also worked with the Canadian Donation Transplant Research Program for a little bit, and was able to help with some research projects there. And the situation I was in is, with organ donation, is someone's taking a really terrible situation and making the best out of it and turning it into a really positive thing. And I'm just so grateful to be here. And I think about my donors and the donor families that in that really hard time had to make a decision to do something out of something that's negative, make something really beautiful. And that's kind of what we try to do with patient partnership, is you take these situations that are not so great, the chronic patients, or just the experiences that we have, and try and turn it into something that's a little more beautiful. So I'm really grateful that I get to do what I do. 1 second, sorry. The meds I'm on. I get dry so easily. I blame everything on the meds. It's like, oh, that happened. It's the meds. So we're really excited to bring you into this presentation. The first little bit is going to be a little more interactive. So Lori and I had a question for you guys, and what we'd love for you to do is to use the discussion forum option that's on the platform that we're using. If you scroll down under the live Q&A part, there's a discussion forum, and in there is where we'll ask that you submit your answers. But we wanted to do some kind of word cloud waterfall activity with you, where in one word, we want you to describe, or how would you describe patient partnership in your practice? And so if you can think of one word to put into this discussion forum, and essential, that's great. Thank you. We know it's working, so that's great.
I'm just going to try to move to the other screen. Maybe I'll try to reload so we can see the comments being made.
Okay, I see some rolling in. Collaborative, even, collaboration, cooperation, team, teamwork. These are great words for sure.
Yeah.
Respect, alliance. Can you see them, Lori?
No, I can't. Oh, here we go. Just hold on. It's in the discussion forum, right? Or
yeah. So if you scroll down just a tiny little bit, and then you can pop that bad boy open, and then they're coming in right there.
Oh, there we go. Team, alliance.
Essential, team.
Yeah.
We have a couple coming in the Q&A area too, so accountability and collaboration. A lot of themes here about teamwork, about partnership, about teamwork, respect. Mine kind of froze. Can you see words now, Lori?
No, I think you've got most of them from what I can see here. Team, alliance, respect, teamwork, journey. So
Okay, that's great. So I think mine was frozen for a second, but I just hit refresh and
trust.
we're good.
Yes. And someone just added trust. It sounds like there's a lot of similar things in terms of what we'd like to see as partnering with our family physicians and that sort of thing.
Yeah, all these
Yeah,
words really resonate with me, and I'm sure you too. You know,
yeah.
you joke about how you've seen almost probably every specialist on the block, but it's true. You've seen so many people, and so many of these words are essential in those relationships that we have with physicians. And unique to each patient.
Well, maybe we could talk a little bit about, what we heard from some patients and give some advice from our own personal perspective as well. So if you feel like I can move on. So, I mean, I mentioned at the beginning, we're on Twitter and both Helen and I I think are on there quite a lot. And there's really a lot of conversations or discussions going on there, whether it's from patients, families, and physicians, health researchers, like you name it. There's quite a sort of health care discussion going on. And so we thought we'd take the opportunity to bring other patients in, not just ourselves, and bring their advice into the conversation before we got into some sort of more tangible advice from our perspective. So we asked the question, what could a family doctor do to help better manage your health or involve you in your care? So I think I got probably about 30 responses or so. And I thought I'd start with this one because a lot of them seem to stem around communication of one sort, whether it was listening or the different aspects of communication. And I thought this was, an interesting quote offered by Patient Commando, which is Zal Press really is behind this. And he lives with Crohn's disease and has for 30 plus years at this point. And so he said, the single biggest problem in communication is the illusion that that it actually takes place. And we can all relate to this in some way, right? Like I have my kids at home, my husband, and I'm sure when you think of some of those day-to-day interactions with those people in your home, there's so many like little misunderstandings like on a daily basis, right? um, you know, and I'm constantly sort of coming in as mediator or clarifying this or that, right? And I guess as frustrating as it may be, it is my job. When I nag my husband to say do something, I need to find like a way to sort of get that across. It's easy to kind of say, oh, they don't listen, or they're not paying attention, or they just don't get it, right? And so I think the same thing happens, when if you transport yourself to sort of your practice, wherever you may practice, in a clinic or not, and try to think about how this might apply to interactions with your patients, and you have, of course, limited time to do this. So I can definitely appreciate all the constraints there, but were you clear in how you communicated it? Was it in words that they could understand, or did you recap with next steps? So and I could tell you myself, as someone who's had a lot of different healthcare interactions, sometimes things like even clarity around the diagnosis isn't always like clearly stated, or what do I need to do next, for example. And so here's some, additional advice offered by patients as well. A lot we're talking about shared decision making and supporting self-management, considering the patient's values and preferences, from Mary Bricaniak. Others noted that having doctors listen to them made them feel validated, right? And you have to remember that sometimes people have come a long way before they can get a diagnosis. So I think this is particularly important. Others noted to have their doctors ask questions, as was really important, right? Sort of just sitting back and listening. Or asking questions like, what matters to you in your particular circumstance? right? So I know, for example, there's one medication I've got to take every week, and I would really like it if I could find ways to better manage that. So really what's important to me is being able to be a good parent, like the next day, for example. Yeah, and so listening skills were noted as well. And that sometimes, physicians don't always have the same priorities as patients do. And I always remember something my dad told me. It was like, you have 2 ears and one mouth, and we should be listening more than we're actually talking, and that sort of thing. So I hopefully, aside from this presentation, I try to follow that advice. And so some carried on and offered some additional advice in terms of, how long was it before they were interrupted? Were they able to kind of tell their full story? And, this is, only 12 votes, but a lot noted, 50% noted that it only took, 10 or 11 seconds. Others mentioned needing resources and tools, training to sort of help increase their health literacy as well, and access to their own information. And so, and there are actually some of those resources we'll talk about in a further slide, but I think it's attached to this presentation, and Helen will talk about it a bit. And then as well, just small things like if you're going to bring someone else into the clinic room or into the room, to ask for permission first and before doing that. So I will let you take it from here.
Yeah, and we were really grateful to those patient partners who answered and gave us their perspectives and so many common themes with the words that you guys have put in the discussion box. And so we wanted to kind of give you 6 quick little tips or things that you could do that are could help involve patients in their care. And so we've broken it down to 6 things. And the first one is help us feel like experts. Something as simple as engaging us in the conversation, because we are experts of our own health. And to believe us and not minimize our concerns is important. We need to feel seen and heard without judgment. We don't have your expertise, but we do have some expertise, some that no amount of money can pay for. And we've lived with our bodies and we know ourselves 24/7. I like to say I'm the CEO of my care because I'm running this business of taking care of myself. And I am an expert. And if I'm treated that way, it definitely makes me feel like I'm more engaged and want to be more engaged in my care. Another thing is to create safe spaces. We want patients to feel like they can be honest and speak up. The moment a physician comes into the room, if they sit down, that step of just sitting down and having a discussion with me, as opposed to standing up and having a discussion with me, feels so different. It feels like the power dynamic changes. The moment they sit down, it feels like it builds this trust. And trust is super important when it comes to healthcare. So sometimes we can't create safe spaces, but we can try and create safer spaces. And by doing that, you're just trying to have these authentic conversations and building that trust. Another thing is to help us speak up. I love this idea of people-centered care. And they say it's a shift from saying, what's the matter with you, to what matters to you. And so maybe starting up with that question and asking people, what matters to you, giving them a pen and paper and saying, why don't you take down any information you have in the discussion that we have. If you have any more questions, please feel free to ask them. Something I like to do now that COVID, a lot of the appointments are over the phone, is I like to have an in case I lose you plan, because I was on a call once with the physician and the call dropped and that was it. I didn't know how to connect with them. They didn't know how to connect with me. And I was like, oh, appointment's over. And there were so many things I still hadn't finished discussing. So to come up with this, in case I lose you plan made me feel like, okay, they want to hear what I have to say. And if something changes, they'll be there willing to listen. Lori, is there anything you wanted to add to this?
No, I think it's great. Thank you.
Okay.
I'll move on to the next slide then, I think.
All right, so those are the first three that we have. And the next three that we have: engage in active listening and try not to shut us down. Because sometimes we can figure stuff out if people just give us the space to talk things through. And to listen with the goal of trying to understand and trying to relate to us, not necessarily trying to fix us. We don't always need you to advocate for us, but sometimes we just need guidance. And something I love to say, and it gives a good image, is that my care providers are the Yoda in my care journey, and I'm Luke Skywalker going through this process. And you are there to guide me and to help me grow and to help me get better. And so to be that person that's there to support the patient, not to be the hero of their story, but the person to help them achieve the goal that they're trying to achieve. So the fifth is to help us and encourage us to share stories. Help us rehearse telling our story, talking about what our lives are actually like, how our illness has affected us on a day-to-day basis, because hearing those things, you might pick up on things that are different. Telling our story makes things make sense to me. Like every time I do, random events make sense and it comes together. And I think when we're sharing our stories with you, it gives you a glance into our realities, and there's an understanding of what matters to us and how we can move forward with that. And the last thing I have to suggest for you is for you to tell your story. Share a bit about yourselves, why you got into medicine. I've been seeing the same physician for years, and I knew almost nothing about her. And then we had this discussion where she started talking about herself, and it felt like I had a way better relationship with her just because she opened up and told me a little bit about herself and her journey towards becoming the physician that she is and the reason she got into it. And when you have a discussion with the care provider about their experience, it kind of changes your perspective on them. And so there's a new perspective that comes into play when there is that exchange of things. Now, I'm really cognizant of the time here. So we've put together some readings and some further, resources that we think you guys could be helpful to you. We actually have a one-pager with all this information in it. As well. So Why We Revolt is an incredible book that's just really, really great. I suggest you read that one. Without Compassion, There Is No Healthcare. That one's great. It just came out recently, and it's kind of talking about healthcare and throughout COVID and virtual care. How Do Doctors Build Trust? Some great articles that we have for you to read. So we would love, if you want to take a look at these resources that we have. And yeah, I'll let you go, Lori, because I'm just talking a lot.
Yeah, I mean, and the last one really is more of a call to action for you folks. Just try to think about one thing you can do differently, in reflecting on what we've said and some of the knowledge or experiences we've tried to share with you. So I'd invite you, similar to the last one, to note that in the discussion chat, I believe, or in the Q&A, whatever works for you. And it's nice to see, based on the poll before, that it sounds like we have very similar attitudes to things. And I hope that you can remember what we've said, and remember, like, to me, to know that every patient has a story to tell, and to try to think about whatever you could do to build that trust and relationship. So show some of yourself will probably mean better health for them. So I don't know if you have any closing remarks, Helen.
No, I don't. That was beautifully said. Thank you so much, Lori.
I'm going to stop sharing so I could see what everyone's written in the in the other page.
So I want to thank you guys so much. You exactly got everything in your timing, and thanks very much to everyone who watched and participated. Sorry we didn't get that last flow of words, but well done. And I want to thank you very much for all that you shared with us today, and we will take this away and be thoughtful of it. So thank you very much, Helen and Lori.
Thank you so much for
Thank-
joining. Thanks.
Thank you so much for attending.